Hello dear, how are you doing? Alright, so walk with me through this Nclex question, right? So let's look at this NGN text format for the Nclex. So it says for each clinical presentation, identify the most likely type of distributive shock, right? So select one option per row, right? So we have client finding, then we have the kind of shock we are to identify it is, right? So we have to identify each of these, whether we are having a septic shock, whether it's an anaphylactic shock, whether it's neurogenic shock. Now, for you to be able to understand this shock, you need to know what they are, right? Now, under distributive shock is a kind of shock whereby we're having problem with the pipe. Yeah, when I teach shock, I use three things to describe shock: the pipe, the pump, and the tank. When we look at tank, we are looking at intravascular fluid within your blood, within your body, right? That is the tank. So if the tank is depleted, we are looking at like hypovolemic shock. Then when we talk about the pump, we are looking at the heart. So when the pump fails, we are talking about a cardiogenic shock. And then when we are talking about the pipe, we are looking about the blood vessels, your arteries, your vein, right? So when they become very, very dilated, what we are seeing in distributive shock is that we are having the parasympathetic is overriding the sympathetic nervous system. So this is going to lead to massive vasodilatation, right? And when we have massive vasodilatation, we're going to have blood stasis. So blood will flow slower, and this will decrease blood flow to those um vital organs, and then we are going to have hypoperfusion, because shock is a state of hypoperfusion whereby those organs are not adequately receiving blood flow. And when they're not adequately receiving blood flow, what they're going to go into, they'll switch to anaerobic metabolism, because we human beings, we make use of aerobic metabolism whereby we use oxygen to break down glucose to liberate energy. That is our ATP. So by the time this blood is not getting to them, they're going to switch to anaerobic, whereby what they're breaking down fat to release energy. And when I can break down fat, we're going to release a lot of lactic acid, and this will now decrease their pH in the body, making them to have a metabolic acidosis, right? Now, let's go back to the question. So we want to identify each of these findings to know whether it's specific to septic shock, anaphylactic shock, or neurogenic shock, right? Now, some people used to confuse neurogenic with spinal shock. Are you from? There are two different things. When you're looking at neurogenic shock, this is usually due to overriding of the parasympathetic nervous system, as I said earlier. So the parasympathetic nervous system is overriding that of the sympathetic, so it will lead to massive vasodilatation. And we see neurogenic shock usually occur mostly with spinal cord injury at the level of T6 or above T6. That is a thoracic vertebrae number 6. So that is it. But when we look at spinal shock, this is just loss of reflex below that level of injury. Yes, that's what spinal shock is. Loss of activities or loss of reflex below the level of injury. All right, so let's dive in. Let's look at what we have to about this question, right? So the first one says sudden hypotension and bradycardia after a T4 spinal cord injury. We are looking at it after a T4 spinal cord injury. Remember I told you about neurogenic shock? This is where we are having that the sympathetic and the parasympathetic are meant to be communicating. They communicate with each other because one opposes the other and the other one opposes the other, right? So when we say neurogenic shock, we establish that fact that usually occur at the level of T6 or above the level of T6. So, and in neurogenic shock, we are going to have hypotension with bradycardia. Unlike in other shock, the compensatory mechanism is usually hypotension with tachycardia. But here we're going to see hypotension with bradycardia. So this first one tells us that we are having a neurogenic shock. Then we are having hypotension, urticaria, stridor minutes after IV antibiotic administration. So when you see this urticaria with stridor, then after we must have given an IV antibiotic administration. So we'll be looking at anaphylactic. In anaphylactic, this is what is happening. Your immune is an immune mediated kind of reaction, right? So usually mediated by your immunoglobulin E. Immunoglobulin E will be released, and this will trigger basophil will be so much in your body, and your mast cells will be high. So and this immunoglobulin E will trigger your mast cells to rupture, and this will release histamine. This histamine is what that goes to your lungs to cause vasoconstriction, and then other stuff, right? So take note. So remember on the Nclex, when you have anaphylaxis, you don't want to give them oxygen first. Are you following? Oxygen is good. You don't want to obey that ABCD for Nclex, right? So when you have anaphylaxis on the Nclex, EpiPen is your best. Epinephrine is your first line, because epinephrine has been helpful to bring about decrease in the bronchial constriction and the rest of them, to open up the airway, and also causes a vasoconstriction as well, to improve the blood pressure. So epinephrine is always your best. If you don't have your epinephrine, you can use the EpiPen. And when we're using that EpiPen, that is the auto injector, we give it directly to their thigh. We're targeting the lateral aspect of the thigh. That is the Vactus lateralis, right? So we are looking at the Vactus lateralis. So and when we're using it, you don't need to pull the client's clothes or jean. You just inject it directly, because we need to save a life immediately. All right. So when we look at this hypotension, urticaria, stridor after an IV antibiotic administration, I'm going to go for anaphylactic shock, right? So it's anaphylactic. Now, the next one says fever, hypotension, tachycardia, 3 days post abdominal surgery with prurient wound drainage. So we are looking at a sepsis here, right? So this is very, very straightforward. So we're going to go for sepsis. And the last one says warm, dry skin below the level of injury with bradycardia and hypotension. Remember, warm, dry skin below the level of injury. Warm, dry skin below the level of injury with bradycardia. So this is more to of what? Neurogenic shock. So that is it, and that is our answer. So for you to get more of this kind of practice, visit Vic-Nclex to access more. All right, so do have a wonderful day. Remember, we also do coaching as well, so you can also reach out for us to be able to help you to build your content for the Nclex, right? So we have in our coaching, we have two major kind of coaching we do. We have the one that can prepare you under 6 weeks, and then we have the one that we can prepare you under 3 months. Now, depending. So if you know that you're still building your content, you're still new on the Nclex, your content is not really too strong, you go for the 3-month class. But if you know that yes, your content is strong, you just want to solidify some area, or you have a few weeks to your exam, you can go for the 6 weeks program. All right. Do have a lovely day. Bye.